We'll start item 2, cardiovascular physiology, item 2. Contents of item 2, cardiac cycle, definition, events, pressure and volume changes during different phases of cardiac cycle, heart sounds, type, characteristics and their significances, ECG, definition, principles and interpretation. First, just I want to recapitulate from anatomy something and I want to draw a figure. Please everybody try to draw with me this figure. Please everybody try to draw this figure with me. Please draw 4 square first time. Then connect this here. This is tissue. Here, right atrium, right ventricle. This is lungs. Here, left atrium, left ventricle. From superior vena cava and through inferior vena cava. From superior vena cava and inferior vena cava, blood comes into the right atrium. And in between right atrium and right ventricle, there is one valve present here named tricuspid valve. Tricuspid valve. That is atrioventricular valve. Now, from right ventricle, blood comes through another valve. This is called pulmonary valve or semilunar valve. Pulmonary valve or another name semilunar valve. This is pulmonary artery. Pulmonary artery. Now, blood comes into the lungs, both sides of the lungs for oxygenation purpose. That is, deoxygenated blood comes into the right atrium. Then from right atrium, blood comes into the right ventricle through valve, tricuspid valve. Then from right ventricle, blood comes into the pulmonary artery through pulmonary valve or semilunar valve. Then from right ventricle, blood comes into the both sides of the lungs for oxygenation purpose. And from lungs, after oxygenation, blood comes through left atrium through pulmonary vein. Pulmonary vein. In both sides, you know that in both sides, 2 pulmonary vein, that is total 4 pulmonary vein present. Through pulmonary vein, blood comes into the left atrium. Here, another valve present here. This is called mitral valve. This is called mitral valve. It is also an atrioventricular valve. That is, it is present in between left atrium and left ventricle. This name is mitral valve. Now, from left ventricle, another valve present here. This is called aortic valve or semilunar valve. That is aortic valve and pulmonary valve. Both are called semilunar valve because they look like semilunar shape, that is half moon. Now, from left ventricle, blood comes into the systemic circulation. This is the total circulatory system of the heart. Again, I am repeating you that from systemic circulation, that is tissue level, uh, through superior vena cava and inferior vena cava, deoxygenated blood comes into the right atrium, and from right atrium through tricuspid valve, blood comes into the right ventricle, from right ventricle through pulmonary valve or semilunar valve or semilunar valve. Semilunar, that is like half moon. Semilunar valve, blood comes into the pulmonary artery. Through the pulmonary trunk or pulmonary artery, blood goes towards the both sides of the lungs for oxygenation purpose, and from lungs through the pulmonary vein, blood comes into the left atrium, and through the mitral valve or atrioventricular valve, blood goes to the left ventricle, and from the left ventricle, blood goes through the aortic valve or semilunar valve. Another name, aortic valve or semilunar valve. Semilunar valve. Blood comes into the systemic circulation, that is tissue level. This is the total circulatory system. আবার পরে একবার একটা This is total circulatory system. Already I have drawn in the blackboard. Now, first topic, cardiac cycle. What is cardiac cycle? Very, very important written question and viva question also. Define cardiac cycle. First definition I have taken from C.C. Chatterjee, the cyclical repetition of various changes in the heart from beat to beat is called the cardiac cycle. That is cyclical repetition of various changes. That is in one cycle, various changes is happening in heart from beat to one beat to another beat. This is called cardiac cycle. Or another definition from your textbook guide, and I think this definition is very easy for you. The cardiac events that occur from the beginning of one beat to the beginning of the next are called the cardiac cycle. This definition is, I think, more easier for you. The cardiac events, please listen to me very carefully here. The cardiac events that occur from beginning of one beat to the beginning of the next, that is one beat to the next beat. What are the events that occurs in the one cycle? This is called cardiac cycle. Here, please concentration here. The spelling of beginning, BEGINNING. Everybody do mistake here, spelling of beginning. So look at her very carefully. Beginning of one beat to the beginning of the next. The cardiac events that occur from the beginning of one beat to the beginning of the next are called cardiac cycle. Now, next definition, very important for a written and viva exam also. What is cardiac cycle time? How much time is required for do this cardiac one cycle, one beat to another beat? It is the time, see the definition, it is the time taken for completion of cardiac cycle is called cardiac cycle time. That is the time which is required for completion of one cardiac cycle is called cardiac cycle time. And this time is always 0.8 second when heart rate is 75 beats per minute. Of course, you have to complete this whole sentence. When heart rate is 75 beats per minute, that time cardiac cycle time is 0.8 second. Cardiac cycle time, always we calculate time divided by heart rate. Always the equation, we always calculate this equation, time divided by heart rate, that is 60 seconds, 1 minute, divided by 75 beats per minute, that is 0.8 second. And always remember one thing, one MCQ question here, very important MCQ question. Cardiac cycle time is inversely proportional to heart rate. If heart rate increases, cardiac cycle time always decreases. Always remember this point. Cardiac cycle time is inversely proportional to heart rate. Suppose heart rate 80 beats per minute. That time, how much cardiac time will occur? That time cardiac, if you calculate this 60 seconds divided by 80 beats, you will get 0.75 seconds. That is, whenever heart rate increases, cardiac cycle time decreases. That is, cardiac cycle time is inversely proportional to heart rate. So we can conclude here that is one cardiac cycle time equal to one systole plus one diastole. We know that systole, what do you mean by systole? Systole means that is contraction. Systole means any contraction. Whenever heart goes to contraction, this is called systole. And diastole means relaxation of the heart. And during diastole, the heart gets its blood supply, that is heart gets filled with blood. Now, what are the events that present in cardiac cycle? What are the events? Of course, two events occurs in cardiac cycle. First, electrical event, then mechanical event. Now, I want to show you in figure. There are two events present in cardiac cycle. Electrical, number one, electrical event. Electrical event. Number two, mechanical event. Two events occur in cardiac cycle, electrical event and mechanical event. Electrical event means ECG. Already I think you know about this because Professor Triptish Chandra Ghosh have taken ECG class, two classes with you. Electrical event. First event is electrical event, that is ECG, and second event is mechanical event. Under mechanical event, lot of things present. That is under mechanical event, which is thing present? Atrial. Atrial systole. In atria, two things present: atrial systole and atrial diastole. Systole means contraction, diastole means relaxation. That is atrial contraction, atrial relaxation. This is atrial event. Now, ventricular event. Now, ventricular event. Ventricular, this is atrial event, atrial systole, under mechanical event, atrial event and ventricular event. This is atrial event. There is atrial systole and atrial diastole. Now, ventricular event. Under ventricular event, present atrial ventricular systole, ventricular systole, ভালো কলম নাই, ventricular systole and ventricular diastole. So we can conclude here, there are two events occurs in cardiac cycle. Number one, electrical event, that is ECG. Number two, mechanical event. Under mechanical event, there is atrial event and ventricular event. Atrial event, atrial systole and atrial diastole. Now, time of the atrial systole. Now, time of the atrial systole, how much? Atrial systole time, 0.1 second. Atrial diastole time, 0.7 second. That is total 0.8 second. Already I mentioned you that cardiac cycle time is 0.8 second. Cardiac cycle time is 0.8 second. See here, atrial systole 0.1 second and atrial diastole 0.7 second. That is total 0.8 second. Now ventricular event, ventricular systole 0.3 second and ventricular diastole 0.5 second. That is again total 0.8 second. That is cardiac cycle time. So we can interpret here that one cardiac cycle, that is one cardiac cycle equal to one systole plus one diastole. See here, one cardiac cycle equal to one systole plus one diastole. See here, atrial systole 0.1 second, atrial diastole 0.7 second, total 0.8 second. That is one cardiac cycle time. Now, ventricular event, ventricular systole 0.3 second, ventricular diastole 0.5 second, that is total 0.8 second, that is one cardiac cycle time. So we can conclude here one cardiac cycle time equal to one systole plus one diastole. So there are two events involved in the cardiac cycle. Now everybody draw with me cardiac cycle. I want to show you the easiest figure of cardiac cycle because in book the figure is very clumsy. That's why I want to draw this figure. Please everybody try to draw with me. Please first put one circle here. Then another circle. Then again another circle. Draw here 3 circles. Please everybody draw here 3 circles. I am not good at drawing, so nobody should mind it, please. Here, please draw 3 circles here and put the middle point in the first circle and give one longitudinal line through the midpoint of this first circle, one longitudinal line and one transverse line. One longitudinal line and one transverse line from the midpoint of the first circle. Then cross line through the midpoint of the first circle. Then again draw cross line from the midpoint of the first circle. See all the compartment divided into 8 areas. See here 1, 2, 3, 4, 5, 6, 7, 8. That is, we want to divide this circle into 8 sections, that is 0.8 second. Because cardiac cycle time is 0.8 second. Now give here at the middle side atrial systole 0.1 second. Already I mentioned atrial systole 0.1 second. Now these area are atrial diastole, atrial diastole, atrial diastole, atrial diastole, all are atrial diastole. That is, this whole area, atrial diastole, whole area 0.7 second. This whole area of atrial diastole 0.7 second. Atrial systole only 0.1 second and atrial diastole total 0.7 second. Now under atrial systole put here ventricular systole. Under atrial systole put here ventricular systole, ventricular systole, ventricular systole. That is 0.3 second. Because we take 3 square area here, 3 square area, that is every area 0.1 second. So 1, 2, 3, that is 0.3 second. Now these are the ventricular diastole, ventricular diastole, ventricular diastole, ventricular diastole and ventricular diastole. And these area 0.5 second, that is we take here 5 square area. 1, 2, 3, 4, 5. So 0.5 second ventricular diastole and 0.3 second ventricular systole. This is the most easiest figure of cardiac cycle. You have to draw in your exam khata this figure because this is easy, very much easy figure. So see here, atrial systole. After atrial systole, ventricular systole is started. So there is two fundamental rule present in
Excuse me,
cardiac
ma'am.
cycle. One thing is atrial systole and ventricular systole never overlap. Please remember this thing.
Excuse me, ma'am.
Atrial systole and ventricular systole never overlap. But see here, atrial diastole and ventricular diastole will always partly overlap. So there are two fundamental rules in cardiac cycle. One thing is atrial systole and ventricular systole never overlap with each other, but atrial diastole and ventricular diastole will always partly overlap. Now we will discuss one by one if what is atrial systole, what is atrial diastole, everything we will discuss one by one.
Excuse me, ma'am.
Now, first event, I mentioned that electrical event of the cardiac cycle. So what do you mean electrical event? Already I mentioned you that ECG, that is each wave or interval represents depolarization or repolarization of myocardial tissue. Now, there are three waves present in ECG. Already you know that in ECG, P wave, QRS complex and T wave. I want to show you the ECG figure of ECG. See here, this is the figure of ECG from your textbook. See, what is ECG? First, you have to know what is ECG. Otherwise, you will not understand electrical event. ECG means electrocardiogram. That is the recording of the electrical changes of the heart in each cardiac cycle from the surface of the body is called electrocardiogram. That is the recording of the
Excuse me,
electrical
ma'am.
changes.
My sound audible?
What are the electrical changes that occur in the heart in each cardiac cycle from the
Ma'am.
surface of the body is called electrocardiogram. And in ECG, see here, wave of ECG, P wave, see here, P wave. Now
Are you
QRS
able to listen
complex
me, ma'am?
and T wave. So there are three things present here, P wave, QRS complex and T wave. Now you have to know when P wave occurs,
Yeah.
when QRS complex occurs, when T wave occurs. This is very important for you. And ECG, next class we'll discuss elaborately about ECG. Now only you have to know the electrical event means here P wave. P wave represent which things? Just this thing you have to now remember this thing
Excuse
here.
me, ma'am.
P wave represents depolarization of atria. That is what is P wave represent which thing? P wave represents depolarization of atria which causes atrial contraction. That is depolarization means contraction. P wave represents depolarization of atria which causes atrial contraction. You have to remember these things, and this is very, very important for your Viva and also for MCQ question. See, P wave. P wave always represent the atrial depolarization means atrial contraction. Now, QRS complex. QRS complex represent which thing? Depolarization of ventricle. See here, QRS complex represent or reflects depolarization of ventricle, which causes ventricular contraction. Now, T wave. T wave reflects repolarization of the ventricle, that is muscle fibers in ventricle. T wave reflects repolarization of ventricles. See here, we mentioned here atrial depolarization, ventricular depolarization, and ventricular repolarization, but we didn't mention here atrial repolarization. What about atrial repolarization? This atrial repolarization, always remember that it merges with QRS complex. See here, P wave. It represents atrial depolarization. QRS complex. It represents ventricular depolarization. T wave. Now T wave, it represents ventricular repolarization. What about atrial repolarization? We didn't mention here atrial repolarization, but it present where it merged with QRS complex. That's why we can see this thing. Atrial repolarization always merge with QRS complex. So atrial depolarization, ventricular depolarization, and ventricular repolarization. You have to three things you have to say here in electrical event. Now this figure from Gannon, PQRS complex and T wave. Now, this is another very important written question, electrocardiographic correlation of cardiac cycle. This is very, very important written question. See here, electrocardiographic correlation of cardiac cycle. That is, what is the relation of electrical event with cardiac cycle? See here, prior to atrial systole, P wave, T wave. Prior to atrial systole, P wave, that is the depolarization wave of atrium occurs. That is, P wave started just prior to atrial systole. This is very important thing. Just prior to, at the beginning of atrial systole, P wave is occurred. Now, similarly, the ventricular depolarization wave, that is QRS complex, when it occurs during ventricular depolarization, that is prior to the onset of the ventricular systole. P wave occurs prior to the atrial systole. QRS complex occurs prior to the onset of the ventricular systole. Now, what about T wave? T wave, which is the repolarization wave of the ventricle. Of course, we know that it is the ventricular repolarization wave. When ventricular muscle fibers begins to relax, that is, it occurs slightly before the end of the ventricular contraction. That is just the last portion of the ventricular contraction or ventricular systole. That time T wave occurs. That is, see here, P wave, it occurs prior to atrial systole. QRS complex, it occurs just prior to ventricular systole. And T wave, it occurs just last portion of the ventricular systole. That is, whenever ventricle beginning to goes towards the relaxation period, that is ventricular diastole, that time, that is end period of the ventricular systole, T wave occurs. That is the end of the ventricular contraction or ventricular systole, T wave occurs. This question is very important for your written exam, and I have taken this from C.C. Chatterjee. You have to nicely memorize this question because it is very important for your first prof exam. Electrocardiographic correlation of cardiac cycle. You have to draw this figure and also you have to write down these things. Now, mechanical events, very, very important things. Mechanical events of cardiac cycle. Already I have drawn this figure in the blackboard. Atrial event, already I mentioned you that atrial systole 0.1 second, atrial diastole 0.7 second. Ventricular events, ventricular systole 0.3 second and ventricular diastole 0.5 second. So see here, one cardiac cycle, that is one cardiac cycle equal to one systole plus one diastole. See here, 0.1 second, 0.7 second, that is 0.8 second, that is one cardiac cycle time. Now, ventricular event, ventricular systole 0.3 second and ventricular diastole 0.5 second, total 0.8 second, that is one cardiac cycle time. So we can conclude here, one cardiac cycle time equal to one systole plus one diastole. I think already everybody understood these things, that atrial event and ventricular event. Now, details about atrial event, there is no fraction here, there is no phases here. Atrial systole and atrial diastole, there is no phase present here. But under ventricular event, ventricular systole and ventricular diastole is divided into different phases. See here, ventricular systole, already you know that it is time is 0.3 second. Again, this ventricular systole divided into three phases. First phase is isometric or isovolumic contraction phase, 0.05 second. Number 2, maximum ejection phase, 0.11 second. Number 3, slow ejection phase, 0.14 second. Again, I am repeating, isometric or isovolumic. You can say this isometric or isovolumic. What is
As
isometric?
we all know
We'll discuss with you later on. Now just only listen to me that there are three phases present in ventricular systole. First phase is isometric or isovolumic contraction phase. Time is 0.05 second. Maximum ejection phase 0.11 second. Slow ejection phase 0.14 second. Now ventricular diastole. There are 5 phases. Yes, this is very critical things. There are 5 phases present in ventricular diastole. We know that ventricular diastole time 0.5 second. First phase is protodiastolic phase, that is 0.04 second. Isometric or isovolumic relaxation phase 0.08 second. Number 3, first rapid filling phase 0.11 second. Number 4, slow filling phase 0.167 second. And number 5, last rapid filling phase 0.1 second. There are 5 phases included in ventricular diastole. Again, I am repeating protodiastolic phase, isometric or isovolumic relaxation phase. Number 3, first filling phase. Number 4, slow filling phase. And number 5, last rapid filling phase. So these are the phases of ventricular systole and ventricular diastole. Now, one by one, I will discuss with you. First things, see, this is the figure from CC chapter 10, the figure of cardiac cycle. But easiest figure already I have drawn in the blackboard, easiest figure. The cardiac cycle figure, please draw this figure in your khata, what I have drawn in the blackboard. This is this figure. That is cardiac cycle. It see here, atrial systole, first thing atrial systole,
nice one, brother.
1 second. Atrial diastole total 0.7 second. Now ventricular systole 0.3 second and ventricular diastole 0.5 second, total 0.8 second. Now one by one, but before that, going to the events or mechanical events of cardiac cycle, you have to know the pressure changes during cardiac cycle. How much pressure present in the right atrium, left atrium, right ventricle and left ventricle, pulmonary artery, aorta. You have to know these things. Pressure changes during cardiac cycle. This is also important for your MCQ question also. Right atrial pressure, see here, ranges of right atrial pressure 0 to 4 millimeter of mercury. You have to memorize very nicely these things. Pressure changes during cardiac cycle. Right atrial pressure 0 to 4 millimeter of mercury. Now, right ventricle pressure during systole. During systole 25 millimeter of mercury. During diastole 4 millimeter of mercury. Always remember that there is similarity you will found right ventricle and pulmonary artery and left ventricle and aorta. See here, right ventricle during systole 25 millimeter of mercury and pulmonary artery, see here, pulmonary artery during systole 25 millimeter of mercury. That is same, but there is something difference during diastole. During diastole, right ventricle 4 millimeter of mercury, but pulmonary artery 10 millimeter of mercury. Left atrium pressure change, see here, pressure range 8 to 10 millimeter of mercury. Now left ventricular, already I have said that there is similarity found in right ventricle and pulmonary artery and also similarity found in left ventricle and aorta. See here, during systole the pressure is 120 millimeter of mercury. Also in aorta, see here, during systole 120 millimeter of mercury, same, but there is difference here. During diastole, left ventricular pressure 10 millimeter of mercury and during diastole aorta pressure 80 millimeter of mercury. Again, I want to repeat this thing. Right atrial pressure, range of the pressure 0 to 4 millimeter of mercury. Right ventricle during systole 25 millimeter of mercury. During diastole 4 millimeter of mercury. Pulmonary artery same, during systole 25 millimeter of mercury. During diastole 10 millimeter of mercury. Now, left atrial pressure, see here, 8 to 10 millimeter of mercury. But whereas in right atrial pressure, 0 to 4 millimeter of mercury. Now, left ventricle during systole, see here, during systole, 120 millimeter of mercury, during diastole 10 millimeter of mercury. Now aorta, see here, same pressure during systole 120 millimeter of mercury, and during diastole 80 millimeter of mercury. You have to memorize very nicely this pressure change. Now this figure from Davidson book. This is international medicine book, Davidson. Here pressure changes given here. You can also mention this pressure also, but I think easy is these things. Pressure changes during cardiac cycle. These two slides is easier for you. And this thing from Davidson. Now we'll discuss one by one. Atrial systole, one by one. Mechanical events. This is written question. Describe the events of cardiac cycle. First event is electrical event, and second event is mechanical event. Now one by one I will discuss with you. First things is atrial systole. This slide I have taken from this slide, Guyton 13th edition, page number 114. Please try to write down this number, page number. Guyton and Hall 13th edition, page number 114. I have taken this thing from your textbook. Now, atrial systole. Systole means contraction, you know that. It initiates cardiac cycle as the pacemaker, that is SC node present in the atrium, that is in right atrium. About 20% of ventricular filling occurs actively during atrial systole. This is very, very important MCQ question. How much ventricular filling occurs during atrial systole? 20% ventricular filling occurs actively during atrial systole. That is by contraction of atrial muscle. Atrial muscle can push the blood towards the ventricle. Only 20% blood it can push towards the ventricle. That is from right atrium towards the right ventricle. 20% ventricular filling occurs, that is 20% blood goes towards the right ventricle, and also from left atrium towards the left ventricle 20% ventricular filling occurs. That is from two atrium, that is, it is simultaneous act. Both atrium always work simultaneously. Always remember that. Never right atrium not alone works and left atrium not alone works. Always they work simultaneously. That is, at a time right atrium and left atrium works. That is, from right atrium blood goes towards the right ventricle, and at the same time left atrium blood goes towards the left ventricle. Simultaneous act. And atrial systole is contraction of the atrial muscle. That is, by working of the atrial muscle, it can push blood towards the ventricle. 20% blood can push towards the ventricle. That is, 20% ventricular filling occurs by active work by atrial muscle. So we can divide this atrial systole into two parts. That is first half and second half. First half and second half. During the first half of atrial systole, there is maximum contraction of atrial muscles and intra-atrial pressure rises. That is atrial systole. Already
Exactly.
Contraction. That is first half of the atrial systole. That is powerful contraction occur. That is atrial muscle contract powerfully, and so whenever atrial muscle contract powerfully, of course intra-atrial pressure rises. That time we know that in the fetal life heartbeat is started during fetal life. So at the first whenever heart works for beginning at the beginning of the heartbeat, ventricular, that is heart gets its blood supply during, of course, diastole. That is atria, both atria fills with blood. Then atrial systole started. That is at the beginning in the fetal life. Whenever heartbeat is started in the fetal life, first time right atrium and left atrium, of course, it will be poured by blood. That is, blood is coming from superior vena cava and inferior vena cava towards the right atrium. That is, it well fill up with the right atrium. Then atrial systole started during the fetal life, that is whenever first time heartbeat is started. So in atrial systole, again I am repeating, in atrial systole, we can divide this atrial systole two half, first half and second half. During first half, atrial, that is maximum contraction of atrial muscles occur. That is, atrial muscle contract forcefully. So intra-atrial pressure, that is in left atrium and right atrium and left atrium, pressure increases because they give maximum contraction of atrial muscles here. And during this period, and during this maximum contraction period, they can forcefully push blood towards the ventricle. That is, from right atrium, blood goes towards the right ventricle, and from the left atrium, blood goes towards the left ventricle. That is, during first half, it will work forcefully and actively, and 20% blood forcefully they can push towards the ventricle. This is the main thing here. But during second half, that is, force of contraction of atrial muscle gradually decreases. That is, force of contraction decrease, and also intra-atrial pressure decreases. That is, second half, there is no work at all. So first half of the atrial systole is very, very important. During first half, maximum work is done during first half, because 20% ventricular filling, they push by contraction of atrial muscles, blood goes towards the right ventricle and left ventricle. And second half, contraction of atrial muscles gradually decreases, and intra-atrial pressure also decreases. This is the simple thing. This is the simple thing of atrial systole. So atrial systole means atrial contraction. Here 20% ventricular filling occurs actively during atrial systole. During atrial systole means first half of the atrial systole. First half, maximum contraction of atrial muscle occur, and the important thing is intra-atrial pressure rises. Whenever maximum contraction of atrial muscle occurs there, intra-atrial pressure of course rises. But during second half of the atrial systole, force of contraction decreases, intra-atrial pressure also decreases. Remember this thing. See here, atrial figure of atrial systole. See here, from the right atrium, during atrial systole, atrial forceful contraction. First half of the atrial systole, force of atrial muscle contraction occur, and blood goes atrioventricular valve, that is tricuspid valve, present between the right atrium and right ventricle. This valve will open when atrial systole occur, and they push blood from right atrium to the right ventricle. That is, right from blood comes towards the right atrium to the right ventricle after opening of tricuspid valve during atrial systole. Again here, see here, from left atrium, blood push towards the left ventricle and opening of the mitral valve, that is bicuspid valve or mitral valve. Opening of mitral valve, blood push forcefully by the contraction of the left atrial muscle, blood comes towards the left ventricle. So during atrial systole, atrial muscle forcefully contract and push the blood from right atrium to right ventricle, and here from left atrium to the left ventricle. This is simple thing, and one important thing is present: how much blood ventricular filling occurs by a forceful contraction of atrial muscle. Only 20%. This is very important MCQ question. 20% ventricular filling occurs by active work of atrial muscle here. Now, 0.7 second atrial diastole. It begins after atrial systole. Of course, atrial diastole is started here. Atrial diastole. Already, this diastole means relaxation. It is, we can divide it two parts also. Like atrial systole, we can divide its two parts, that is first half and second half. See here, atrial diastole, we know that diastole means relaxation, and during this time, heart fills with blood, that is heart gets its blood supply. So during the first half of the atrial diastole, atria collect blood from the vena cava, that is from superior vena cava. It collects upper part of the body. Superior vena cava collect blood from upper part of the body, and through the inferior vena cava it collect blood from the lower part of the body, and also through pulmonary veins, and through the pulmonary veins, that is left atrium, that is right atrium collect blood from the superior vena cava and inferior vena cava, and left atrium, already I mentioned that right atrium and left atrium, there is simultaneous act. They work at a time. That is, left atrium collect blood from where? From, of course, from pulmonary veins. Left atrium collect blood from pulmonary veins, and AV valve that time remain closed, because if AV valve open, all blood go rushes towards the ventricle, but you have to collect blood here. So during diastole, AV valve, that is atrioventricular valve, both tricuspid valve and bicuspid valve, both valve remain closed here. During that time, atria get its blood supply, that is atria fill up with blood from vena cava and pulmonary veins. Now, during the second half, AV valve open and blood passes from the atria to the ventricle, and about 80% of the ventricular filling occurs passively during atrial diastole. This is very, very important thing here. During the second half, whenever right atrium and left atrium filled with blood, there is so many blood is filled up with this right atrium and left atrium, that is blood rushes from the right atrium, from the right ventricle, and from the left atrium towards the left ventricle passively. That is, there is no need of active contraction. Diastole means relaxation. There is no muscular contraction occurs here. So the rushes due to filling of the blood, that is from the superior vena cava and inferior vena cava, blood comes towards the right atrium, and from the through the four pulmonary veins blood comes into the right atrium. Whenever right atrium and left atrium fills with blood, that time passively, that is blood push towards the right ventricle and left ventricle passively. There is no need to any atrial muscle contraction here. That is passively 80% of ventricular fillings, that is blood goes towards the right ventricle and left ventricle without any work. That is 80% of the ventricular filling occurs passively during atrial diastole. This is very, very important MCQ question. So MCQ question, first question, during atrial systole, that is by active work by the atrial muscle, only 20% ventricular filling occur, but without any work during atrial diastole, passively 80% ventricular filling occurs. This is the difference between atrial systole and atrial diastole. See here figure, atrial diastole. See, AV valve during atrial diastole, AV valve remain closed. Atrioventricular, that is tricuspid valve, and bicuspid valve, both valves are closed, remain closed, because right atrium get its blood and filled with blood, and left atrium also filled with blood. Right atrium filled blood with superior vena cava and inferior vena cava, blood comes towards the right atrium, and here through the pulmonary vein, this left atrium is filled with blood. Both valves remain closed, and right atrium and left atrium, whenever filled with so much blood, the time rushes of blood from right atrium and from left atrium towards the ventricle. That is 80% ventricular filling occurs during atrial diastole. Only 20% ventricular filling occurs during atrial systole. Now, this is very, very important things, ventricular systole. Ventricular systole. You have to, this is very important written question, describe the mechanical events of cardiac cycle. First, you have to write down atrial systole and atrial diastole. Now, ventricular systole. Already I mentioned that ventricular systole 0.3 second. It begins after the atrial systole. It begins after the atrial systole, that is, it has following phases already. We know that there are three phases present in ventricular systole. First phase is isovolumetric or isovolumic or isometric contraction phase. We can say this phase three name, isovolumetric or isovolumic or isometric. Iso means same, metric means length. That is, in this phase, muscle doesn't shorten, but the tension increases. There is, in this phase, there is no change in the muscle fiber. There is no change in the length of the muscle fiber. Iso means same, metric means length. There is no change in the muscle fiber. That is, length of the muscle remains similar length, but their tension is increased. It is the interval between the closure of the atrioventricular valve and the opening of the semilunar valve. Already we discussed about atrial systole and atrial diastole. Now I want to show you again in the figure isovolumetric contraction phase. In this phase, it is the interval between the closure of the AV valve and the opening of the semilunar valve. Ventricular systole. Systole means contraction. Now, ventricle will go ventricular contraction. So, whenever all blood now already by atrial systole and atrial diastole, 100% ventricular filling already occurs. That is, all blood comes into the right ventricle and left ventricle. Think about this. After atrial systole and atrial diastole, all blood comes into the where? Right ventricle and left ventricle. Now see, ventricular systole started. After atrial systole, already in figure I mentioned you that after atrial systole, ventricular systole is started, and ventricular systole is partly overlapped with the atrial diastole. That is, whenever atrial diastole is going on, ventricular systole is also going on the time. See here, it is the interval between, very important thing, interval between the closure of the AV valve, because during atrial diastole, AV valve, AV valve that time remain closed, and opening of the semilunar valve. During ventricular systole, AV valve must be closed and opening of the semilunar valve occurs because during ventricular systole, ventricle contract and it pushes blood. Right ventricle pushes blood towards the pulmonary artery and left ventricle pushes it blood towards the aorta. So semilunar valve, that is pulmonary valve and aortic valve, that time must be opened. Otherwise, this during ventricular systole, blood goes towards the aorta and also towards the pulmonary artery. So semilunar valve must be opened here, but AV valve remains to close here. So it is the interval between the closure of the AV valve and opening of the semilunar valve. This period is called isovolumetric or isovolumic or isometric contraction phase. You can say simply isometric contraction phase. See here, at the onset of the ventricular systole, AV valve closes and produces first heart sound. During onset of the ventricular thing, that atrial systole, it causes 20% ventricular filling, and atrial diastole started, it causes 80% ventricular filling during atrial diastole. Now isovolumetric contraction, that is ventricular systole, started that time. So during ventricular systole, you must close the AV valve. Otherwise, contraction is not possible. You have to push from blood from ventricle towards the aorta, towards the pulmonary trunk, that is pulmonary artery, that is right atrium, right ventricle towards the blood goes from right ventricle towards the pulmonary artery, and from left ventricle blood goes towards the aorta. So you have to open the semilunar valve and you have to close the AV valve. AV valve, that is tricuspid and bicuspid valve. Without closure of the bicuspid and tricuspid valve, you can't contract the ventricles. So first you have to close the which valve? AV valve. See, at the onset of the ventricular systole, whenever ventricle goes towards the contraction phase, first you have to close the atrioventricular valve, that is tricuspid valve and bicuspid valve. Then and produces whenever AV valve closes, that time, that is sudden closure. See here, listen to me very carefully. Sudden closure of the AV valve produces first heart sound. It produces vibration. Sudden closure of the AV valve produces vibration, which produces first heart sound. At the onset of the ventricular systole, AV valve closes and produces first heart sound. That is, sudden closure of the ventricular systole produces AV valve closes and produces first heart sound. The ventricle contracts. Whenever AV valve closes, that time semilunar valve not open that time. So the ventricle contract as a closed cavity and no blood passes out. So interventricular pressure rises very sharply because think about this, AV valve now closed, semilunar valve till now not open. That is, both door is closed that time. That is, in right ventricle and left ventricle, both valve is closed. That is, both door is closed. Ventricle contracts as a closed cavity. That is, tricuspid valve closed here, bicuspid valve also closed, and semilunar valve, that is pulmonary valve and aortic valve also closed. So both doors is closed on both sides. So ventricle contract. That is, ventricular systole means ventricular contraction. So ventricle contracts as a closed cavity and no blood passes out. So intraventricular pressure rises sharply. Whenever ventricle contract, intraventricular pressure rises very sharply. When intraventricular pressure exceeds the pressure in the aorta, that is 80 millimeter of mercury. We already mentioned pressure in the aorta during diastole, 80 millimeter of mercury. When left ventricular pressure exceeds the pressure in the aorta, that is 80 millimeter of mercury, and right ventricle exceeds the pressure in the pulmonary artery, that is 10 millimeter of mercury, the semilunar valve that time open and the phases ends. That is, whenever semilunar valve open, all blood goes towards the, from right ventricle towards the pulmonary artery, and from the left ventricle towards the aorta. This is the ventricular systole first phase, that is isometric contraction phase, that is isovolumetric or isovolumic or isometric contraction phase. Again, I am repeating you, the ventricular systole means contraction. Systole means, always remember that, contraction. Already I have described that during atrial systole, 20% ventricular filling occurs actively. During atrial diastole, 80% ventricular filling occurs passively. Now, ventricular systole, atrial systole, diastole finish. Now, ventricular systole. Ventricular systole first phase, isometric contraction phase or isovolumetric contraction phase. Iso means same, metric means length. That is, there is no change in the muscle fiber length here, but tension, muscle tension is increases here. It is the interval between the closure of the AV valve and opening of the semilunar valve. It is the period of the closure of the AV valve and opening of the semilunar valve, because without opening of the semilunar valve, by ventricular contraction, you can't push the blood towards the pulmonary artery and the aorta, because two ventricle acts simultaneously at a time. See, at the onset of the ventricular systole, whenever ventricular systole starts, AV valve, sudden closure of AV valve occurs here. Sudden closure of AV valve occurs, that is, it produces first heart sound. Here, Viva question, we ask you that when first heart sound occurs during cardiac cycle. First heart sound always occurs in isometric contraction phase, that is during ventricular systole, first phase, that is in isometric contraction phase. It produces sudden closure of AV valve, produces vibration of the AV valve and produces first heart sound. So first heart sound always occurs in isometric contraction phase, that is during ventricular systole. This is very, very important MCQ question and also Viva question. When first heart sound occurs, it occurs during ventricular systole in isometric contraction phase due to sudden closure of the atrioventricular valve. Here always mentioned here, sudden closure of AV valve produces faster sound during isometric contraction phase, that is in ventricular systole. This is very important question here. So AV valve sudden closed, semilunar valve till now not open here. So this two door is closed. So ventricle contract in a closed cavity. So interventricular pressure rises sharply, and when semilunar valve, you have to open semilunar valve. Otherwise, blood not push towards the pulmonary artery and aorta. From right ventricle, blood have to go towards the artery, and from left ventricle, blood goes towards the aorta. So you have to open the semilunar valve here, and you have with open, for opening purpose, you have to raise the interventricular pressure. That is raising of the when the interventricular pressure, that is left ventricular pressure, raises 80 millimeter of mercury, which is the aortic pressure. That is pressure in the aorta, 80 millimeter of mercury. When you overcome this pressure, left ventricular pressure, that time semilunar valve, aortic valve will open, and whenever this right ventricle overcome the pressure present in the pulmonary artery, that is 10 millimeter of mercury, that time pulmonary valve, that is another type of semilunar valve, will open. So semilunar valve, AV valve closed, semilunar valve open. This is the period of isometric contraction phase. That is whenever semilunar valve open, all blood pushes towards the pulmonary artery, that is from right ventricle towards the blood goes towards the pulmonary trunk, that is pulmonary artery, and from left ventricle, blood goes towards the aorta. This figure I have taken from internet, atrial systole. Now isometric ventricular systole, isometric contraction phase, ejection phase. See here, ejection period. This is ventricular, diastole, protodiastolic, isometric relaxation, rapid and slow filling phase. These are the figure of cardiac cycle. Now ventricular, first phase, we discussed that in ventricular systole there are three phases we mentioned: isometric contraction phase, number two, ejection phase. Ejection phase, we can divide this phase two phases: maximum ejection phase, that is maximum blood passes from right ventricle and left ventricle, and slow ejection phase, that is minimum blood passes from right ventricle and left ventricle. There is ejection phase. During this period, blood is expelled from the ventricles, from both ventricles, from right ventricle and left ventricle. Both atrium and both ventricle always work simultaneously. See here, during this period, in ejection phase, during this period, blood is expelled from the ventricles, that is from the left ventricle into the systemic aorta. From, see here, listen to me very carefully, from the left ventricle into the aorta, and from right ventricle into the pulmonary trunk. Ejection occurs from right ventricle towards the pulmonary trunk, that is pulmonary artery, and from left ventricle towards the aorta. Maximum ejection, that is first part of the ejection phase, during which outflow is very rapid, that is 70% blood pushes towards the pulmonary artery during first phase, that is maximum ejection phase. This is very important MCQ question. How much blood passes in maximum ejection phase? 70% blood, according to your textbook Guyton and Hall, that is 70% blood pushes towards the right ventricle, towards the pulmonary artery, that is also from left ventricle towards the aorta, that is 70% blood. First part of the ejection phase occurs. 70% blood passes out. In the last part of the ejection phase, only 30% blood passes out, that during which the outflow is minimum. There is only 30% blood passes out that time. I will show you in figure in blackboard after finishing this thing. So atrial systole we finish, atrial diastole we finish, already we finished ventricular systole. Ventricular systole three phase. First phase, isometric contraction phase, and now second phase is ejection phase. Ejection phase again divided into two phase: maximum ejection phase and slow ejection phase. In maximum ejection phase, maximum blood passes out, that is 70% blood passes out. In slow ejection phase, only 30% blood passes out. Now, atrial ventricular diastole. Now, ventricular diastole, it is divided into 5 phases. It starts at the end of the ventricle, of course, after finishing of the ventricular systole. Now, ventricular diastole occurs. Diastole means relaxation. Ventricle now get its blood supply. That is, ventricle now fill with blood. First phase is protodiastolic phase. It is the interval before ventricular, during ventricular systole, semilunar valve is open, opening of semilunar valve occur, and closure of the AV valve occur during ventricular. আসছে See here, I have drawn this figure again for your better understanding purpose. Again, I am repeating atrial systole. During atrial systole, atrial contraction occurs. That is first half of the atrial contraction. Atrial muscle contracts forcefully and 20% ventricular filling occurs. That is, from right atrium, blood goes towards the right ventricle, and from the left atrium, blood goes towards the left ventricle. During atrial systole, that is 20% ventricular filling. That is, right ventricle and left ventricle fill 20% by the action of the atrial systole. And during atrial diastole, atrial first half of the atrial diastole, it gets its blood supply, that is from superior vena cava and inferior vena cava. Right atria is filled with blood, and left ventricle, it gets its blood supply from the left atrium, it gets its blood supply from the pulmonary vein during atrial diastole. During atrial diastole, pulmonary, through the pulmonary vein, left atrium filled with blood, and during atrial diastole, right atrium gets its blood from its superior vena cava and inferior vena cava. And whenever blood fill with this right atrium and left atrium, 80% ventricular, that is so much blood gathered in the right atrium and left atrium, and it push this blood push towards the right ventricle by the opening of the tricuspid valve. There is valve present in the right atrium and right ventricle. This name of this valve is tricuspid valve, and between the left atrium and left ventricle, the valve is bicuspid valve or mitral valve. There is opening of the so many blood collects within so much blood collect within the left atrium and right atrium, and these blood push towards the right ventricle and left ventricle, and opening of the atrioventricular valve opens here. That is tricuspid valve open and mitral valve open passively. 80% ventricular filling, that is from left atrium, blood goes towards the left ventricle passively without any work, passively because of rushes of blood from left atrium towards the left ventricle and rushes of blood from right atrium towards the right ventricle. 80% ventricular filling occurs during atrial diastole. Now, so atrial systole finish and atrial diastole already we finished. Now, ventricular systole. Already mentioned that ventricular systole 3 phases. That is isometric contraction phase, maximum ejection phase, and slow ejection phase. That is ventricular systole means ventricular muscle contraction. Now, during atrial diastolic phase, already in tricuspid valve and mitral valve, that is AV valve is open that time because all blood comes into the right ventricle and left ventricle. So during ventricular systole, first phase is isometric contraction phase. That is during ventricular systole, you have to open the semilunar valve because blood already comes into the right ventricle and the left ventricle, and you have to open this valve, semilunar valve. Without opening this valve by ventricular systole, that is contraction of ventricular muscle, blood will not go towards the pulmonary artery, and here from left ventricle blood will not go towards the aorta. So you have to open this semilunar valve, and you have to close this mitral valve and tricuspid valve, otherwise ventricle will never contract here. So first you have to close this AV valve, that is tricuspid and mitral valve, then you have to open the semilunar valve. So first phase is isometric contraction phase. In this phase, first sudden closure of the AV valve produces first her sound and ventricle contract. See here, sudden closure of the AV valve occurred, that is tricuspid valve and bicuspid valve, both valve whenever sudden close, semilunar valve till now not open, that is this door closed and this door closed, that is AV valve closed and semilunar valve closed. So both ventricle contract in a closed cavity. So intraventricular pressure rises in isometric contraction phase. First heart sound always occurs in isometric contraction, that is the first phase of the ventricular systole, isometric contraction phase, due to sudden closure of the AV valve. Now, AV valve closed, semilunar valve closed, both valve is closed, and ventricle contract within the closed cavity, intraventricular pressure rises. This is called isometric contraction phase. Now, semilunar valve is now open. Opening of semilunar valve occurs whenever pressure of right ventricle exceeds the pressure of pulmonary aorta, that is 10 millimeter of mercury, and pressure of the left ventricle exceeds the pressure in the aorta, that is 80 millimeter of mercury. That time semilunar valve open. So AV valve closed. Now semilunar valve open. All blood comes from right ventricle into the pulmonary artery, and from the left ventricle blood goes towards the aorta. So this is the ejection phase, and first phase of ejection is maximum ejection phase. That is 70% blood goes towards the pulmonary artery during maximum ejection phase. That is first phase of the ejection, and slow ejection phase only 30% filling rushes of the blood passes out during slow ejection phase. This is all about ventricular systole. Now ventricular diastole. systole, that is 0.3 second, diastole 0.5 seconds. See here one thing, last portion of the ventricular systole and diastole coincide, that is last portion, last filling phase. This is last filling phase of ventricular diastole. Last part of the ventricular diastole always coincide with atrial systole. That is, whenever atrial systole is started, that time last part of the ventricular diastole already started here. That is, it coincides with each other, atrial systole and ventricular diastole. Now, I'll show you that ventricular diastole first phase. First phase of the ventricular diastole is protodiastolic. This ventricular diastole first phase. First phase is protodiastolic phase. Already I have shown you that first phase is name of the first phase, protodiastolic phase. Second phase, may isovolumetric or isometric relaxation phase, then first rapid filling phase, slow filling phase, and last rapid filling phase. There are five phases included in the ventricular diastole. First phase, protodiastolic phase. Second phase, isometric relaxation phase. And third phase, first rapid filling phase, slow filling phase, and last rapid filling phase. This last rapid filling phase always coincide with the atrial systole. Think about ventricular diastole. Ventricular diastole means ventricle gets its blood supply during this phase. হচ্ছে তো না, এখন একটু স্লাইডে যাব। নাজুক। এটা যাচ্ছে না কেন? Just see here the description of ventricular diastole. আরেকবার একটু যেতে হবে আমাকে। The ventricular diastole, it starts at the end of the ventricular systole. It has 5 phases. First one is protodiastolic phase. Protodiastolic phase, that is, it is the interval between the onset of diastole and the closure of the semilunar valve. See here, what is protodiastolic phase? Protodiastolic phase, diastole means ventricle now relaxation, goes towards the relaxation period, that is ventricle filled with blood this time now. So right ventricle, and think about right ventricle and left ventricle, now they become relaxed and they get blood supply. That is, right ventricle gets its blood supply from the atria, right atria, and left ventricle also gets its blood supply from the left atria. First phase, protodiastolic phase. So it is the interval between the onset of the diastole and the closure of the semilunar valve. During ventricular systole, you close the semilunar valve, AV valve, and open semilunar valve. Now you have to close the semilunar valve, otherwise blood will not collect within the ventricle. Otherwise, blood will not collect within the ventricle. So it is the interval between the onset of diastole and the closure of the semilunar valve. In this phase, ventricle of course relax. Diastole means relax. So intraventricular pressure falls. When intraventricular pressure falls below the pressure in the aorta and pulmonary artery, the semilunar valve closes and produces second heart sound. This point is very important here. When second heart sound occurs during cardiac cycle, during protodiastolic phase, that is first part of the ventricular diastole, during protodiastolic phase, sudden closure of the semilunar valve produces second heart sound. Because without closing of the semilunar valve, blood will not collect in the right ventricle and left ventricle. So sudden closure of the semilunar valve produces second heart sound here. Now, isovolumetric or isometric relaxation phase. It is the interval between the closure of the semilunar valve and opening of the AV valve. Now, semilunar valve closed. Now, AV valve now needs to open, because otherwise blood will not come in the right ventricle and left ventricle. So, if semilunar valve now closed and opening of AV valve is occurring here. The ventricle relax as a, see here, AV valve need to open and semilunar valve already closed. Still now AV valve is not open. So AV valve closed and semilunar valve already closed, two valve closed. So ventricle relax in a closed cavity and no blood enters into the ventricle because two door is closed. Semilunar valve just now closed and AV valve till now not open. So two door is closed, so no blood enters within the ventricle. So ventricle relaxed as the closed cavity, so the interventricular pressure falls sharply because no blood present in the within the ventricle. That's why interventricular pressure falls sharply. When interventricular pressure falls below the atrial pressure, the AV valve open and the phases ends. That is, whenever interventricular pressure falls below the pressure in the atria, that time AV valve open and blood goes towards the ventricle, because during ventricular diastole, of course, it need to be during ventricular diastole, ventricle gets its blood supply. How? From where? From atria. Opening of the after opening of the AV valve. Now AV valve open. Now AV valve open. All blood rushes towards the ventricle. This is isometric relaxation phase. Iso means same, metric means length. There is no change in the muscle length fiber here. That's why it is called isovolumetric or isometric relaxation phase. Now, first rapid filling phase. It begins with the opening of the AV valve. Already AV valve open. So first rapid, blood already collect within that time already blood collection occurs within the right atrium and left atrium. So all blood rapidly rushes within the right ventricle and left ventricle. That's why this is called first rapid filling phase. It begins with the opening of the AV valve and blood rushes rapidly from atria into the ventricle and produces third heart sound. This is very, very important thing. Whenever third heart sound occurs in cardiac cycle, it occurs during ventricular diastole, that is first rapid filling phase, third heart sound occur. Fourth thing, slow filling phase. The amount of filling is in this phase is very minimum. That's why it is called slow filling phase. Last rapid filling phase, here ventricular diastole coincide. Already mentioned you that last rapid filling phase of the ventricular diastole always coincide with the atrial systole. Due to atrial contraction, rushes of blood into the ventricle in this phase and produces fourth heart sound. This is very important for MCQ question, Viva question. When fourth heart sound we heard due to when fourth heart sound occur, we cannot hear third and fourth heart sound by stethoscope. Only first and second heart sound we can hear by stethoscope, by using stethoscope. But third and fourth heart sound we cannot hear by stethoscope. Later on I will discuss with you whenever I discuss heart sound. See here, only just when fourth heart sound occur during last rapid filling phase, fourth heart sound occur. Again, this figure, atrial systole, atrial diastole. See here, I want to show you that during atrial systole, see here, last portion of the ventricular diastole. This is the last rapid filling phase. This last rapid filling phase always coincides with the atrial systole. That is, at a time these things occur. And so whenever ventricular last rapid filling phase occurs, that time atria goes to the systolic phase. So this last rapid filling phase always coincide with atrial systole, and during last rapid filling phase, fourth heart sound occur. When first heart sound occur, first heart sound always occurs in the isometric contraction phase. That is in ventricular systole. First phase of the ventricular systole, isometric contraction phase, first heart sound occur. When second heart sound occur during ventricular diastole, first phase of the ventricular diastole, protodiastolic phase, second heart sound occur. When third heart sound occur in the first rapid filling phase. In this phase, first rapid filling phase, third heart sound occur, and the last rapid filling phase, fourth heart sound occur. Now this is the last written question for you. What are the changes takes place during cardiac cycle? We are today, this is the last slide for you. What are the changes takes place during cardiac cycle? Changes in pressure. Next class, again I will repeat cardiac cycle with figure. Again, next class I will repeat cardiac cycle again with figure. Please don't take any tension about cardiac cycle. Of course, I will repeat this again in the next class. Okay, please write down this question. This is an important written question. What are the changes takes place during cardiac cycle? During cardiac cycle, what the changes occur? First change in the pressure, that is changes in the intraventricular pressure, intra-atrial pressure change within the aorta, pressure changes within the pulmonary artery. That is pressure change, first point. Number two, volume change. There is changes in the volume. Number three, production of heart sound and apex beat. Number four, production of pulse and appearance of pulse wave. Number five, electrocardiogram changes, that is ECG change. So there are 5 changes occurs during cardiac cycle. This is very, very important written question. Please students, everybody write down this question. This is very important written question. What are the changes takes place during cardiac cycle? Please no need to be worried at all, because in the next class, of course, I will repeat this cardiac cycle again, because this is very complicated thing for undergrad student. So I have to repeat these things again. Thank you very much. Thank you, everybody.
Thank you, ma'am.